Dear all, as scheduled today we will be discussing about rheumatoid arthritis and its psychological aspects. This session emphasizes about the patients who are suffering from rheumatoid arthritis will be facing some of the unknown factors physically and psychologically. By watching this session you will have the brief details about the psychological aspects to overcome the false unknown psychological stressful thoughts you will be currently triggering your brain all the times. Watch this talk till last to know complete details, so that you can overcome easily.
Good afternoon, everyone. Today, we, Standard Rheumatology Immunology Center and Research, have organized talk on rheumatoid arthritis and its psychological aspects by our clinical psychologist, Ms. Rajeshwari. Rajeshwari is also a CBT practitioner. Rajesh, put some insights on mental health when living with rheumatoid arthritis.
Yeah, thank you. So today we'll discuss how rheumatoid arthritis will affect our mental health and how we can cope up with that. What are the strategies that we can use to cope up with that? So first, what is rheumatoid arthritis? So what are the main physical things that we can see when a person is affected or person is diagnosed with rheumatoid arthritis? So it is an autoimmune disease which affects 0.3 to 1% of the population globally. So what is rheumatoid arthritis? So it is a long-term disease, that is, it is something chronic. It is not like fever or cold which can be settled down within a week or within some days. So when you have or when you are diagnosed with rheumatoid arthritis, there are some somatical changes that takes place. That is inflammation, stiffness, bodily pain. So along with the somatic symptoms, there are emotional and psychological changes that takes place. So here, when we speak about the mental health issues in terms with RA patients, one thing we have to keep in mind is that not all RA patients are affected with mental health issues. 60 to 70% of the patients can overcome this rheumatoid arthritis with good management. How to manage if a person is diagnosed with RA, and with proper medication and physiotherapy exercises. But again, there are 40 to 30% of the population where they need some help, external help, because one, they don't know how to manage their health condition, and they may not have enough emotional support from the family. So how it can complicate the condition, what are the things which we have to do, and what are the things which we should not do, that we have to see. What is mental health in terms of RA? So when we call a person is doing well, so when a person has good physical health, good mental health, and good social well-being, then we say the person is doing good. So in rheumatoid arthritis, physical health implies that is your stiffness or the joint pains you have. So how this stiffness or the joint pains or the chronic pain will lead to mental health issues, and how a person can cope up with that, and how that mental health issues may lead to social changes or is interpersonal changes. So this is how we can define mental health in rheumatoid arthritis patients. So when we speak about mental health in RA, we have to classify that into two. That is, did mental health issue raise the chronic pain, or did prolonged mental health issue led to the chronic pain? So it is bidirectional. It can be bidirectional also. So we have to see whether we have mental health issues because we had chronic pain or the physical or the somatic symptoms, or is it because of the mental health issues the person is having chronic pain. So when a person gets clarified in these aspects, it is very easy to manage the pain, and when you know the starting point, or when you know where the problem is arising, then you can solve the problem very easily, or else it will get complicated even more. So what are the psychological and emotional effects? So one is depression. So we hear depression a lot in day-to-day life. We hear a lot of people talk about depression. A lot of people say I'm depressed, but usually people don't know what are the clinical symptoms. That is, when we can say a person is depressed, or is there any clinical criteria for that? Yes, there are clinical criteria to assess. Just because you are sad for a day or 2 days, you can't say that I am depressed or I'm undergoing some depression. So there are clinical criteria for that. There are assessments done by the therapist to see are you in depression, what kind of depression you have, and what are the reasons for that. So in RA, what happens, since you have stiffness, since you have some visible deformity, or since you have a lot of restrictions in your day-to-day activities, you may tend to undergo depression. Here the person will not be able to do his regular activities. He want to give more to his family, or he want to do something good in his day-to-day life, but he is not able to do. That is where he feels low. That is where he wants to shut himself in photos and sit inside the house. The one more is anxiety. So when you start stressing a lot on your physical symptoms, when you start stressing minute details of your disorder, then you start stressing over that, then that is where your anxiety builds up. So what happens when anxiety builds up? You go through panic attacks. So there are few patients who come and who undergo this panic attack, and they don't know what exactly it is. One thing, they don't know what is panic attack. So what are the things or what are the symptoms you have when you undergo panic attacks? So usually when a person is having panic attack, we can see raise in the heartbeat, we can see palpitation, we can see sweating, chillness. So there are a lot of things which happens when you have panic attacks. So again, it is not most of the some patients may overcome this panic attack easily, and some patient may not be able to cope up with that. That is where they have to consult a therapist or a counselor. So they need some help, like how to deal with that, what are the things you have to do when you have panic attacks. So how you can work with that. So one more thing is navigating from the management of RA. So here, when you have RA, the main thing what the patient should know is how to manage. So once the patient comes to know how to manage RA, rheumatoid arthritis, it will be very easier for them to lead their life along with RA and the pain or whatever the symptoms they are facing. So once the patients navigate, or once the patients fail to understand how to manage that, what are the medication that has to be taken, or what are the treatment that has to be followed, and what are the exercise that has to be done, that is where the patients or the lifestyle of the patient goes wrong. So once the patient get a hold on the management of RF, then it will be very easier for them to deal with that. They will start accepting what they are having, and they can lead a good and a happy journey with the rheumatoid arthritis. So one more, then comes loss of appetite and insomnia. That is, you will see changes in your eating pattern. You will see changes in your sleep pattern. So sometimes because of the stress you take, you may start eating more. That is what we call as binge eating. And sometimes your sleep, because since you have a lot of pain, stiffness, you may not be able to sleep that proper 5 to 6 hours sleep that a person needs. So obviously when you when you lack sleep, normal basic sleep, then it will affect your day-to-day life. During the daytime, you may not be feeling to do all the works which you are doing before, or you may feel tired, you don't want to talk to others, you may get irritated for small things. So when patients come to us with sleep disturbances, what we usually say is stop sleeping during the daytime. So there are few people who would like to sleep during the daytime. So obviously when you sleep during the daytime, night you will not get that proper sleep. Then you stress on that also, why I'm not getting the sleep, when do I get the sleep. So again, that will increase your stress. So have a good sleep pattern, go to bed early, and so that you can get up early in the morning, and you can do some exercises, you can have a healthy lifestyle. So what are the social effects? Along with psychological effects, we also face social effects. That is how a person's surroundings get affected. What are the interpersonal changes that takes place? So one and obvious thing is personal relationship. So a person's personal relationship, maybe with his spouse or maybe with his children, will change. His sexual life may get affected. If a person is working in an IT company, then he has to travel, he has to work there, he has to sit for some time, maybe 8 hours, 9 hours in that work setting. So he will not be able to do that regular activities. So that is where your relationship or the interpersonal relationship changes. Then physical activities, especially if the person is a sports person or he is doing some kind of gymnastic or any kind of sports activities. So the main his main basic thing is getting disturbed. So he will not be able to do his regular activities or the rigorous exercises which he was doing before. So here the person will have difficulty in accepting that all of a sudden. So he needs some time to accept that, and he how to manage with that body condition. So because of all that, sometimes they may undergo alcohol addiction. So usually when we ask the patients why you have you're taking alcohol or any kind of drug addiction, so the answer what we get is medication is not helping, only the alcohol or the drug is the only thing which is helping me currently, and that is what is making me a little relaxed or a little happy. So yes, when you take alcohol, there are some chemical changes that takes place, so because of which we may feel good or relaxed, or your pain may get reduced a little. But again, when you get up in the morning, your intensity of the pain increases. So again, when the pain increases, again you go back to addiction, so the circle continues. So that is where your health gets upset. So here you are losing your physical health also, and along with that your mental health is also getting disturbed, and along with that you will be taking medication. So on medication, so if you're taking alcohol, it is not good. So usually don't get into any kind of addiction which will affect in both the ways. So next, treatment. So what are the treatments available? So we have different kinds of different kind of treatments, that is therapies. We have cognitive behavioral therapy, we have general counseling, we have JPMR techniques, we have group counseling, we have. So usually what kind of treatment a person needs will be decided only after the first session, that is in the general counseling. So in general counseling, what we do is we speak to the patient. So here usually the patient will they don't have much problem, they just need some advice on how to manage their body condition, how to cope up with that, and how to deal with the pain, and how to live with that. So they need some kind of advice. So after that they are okay, or they know how to they'll be knowing how to manage. So after general, if the patient has more than one kind of problem, like along with managing, he is facing various other psychological issues, that is where cognitive behavioral therapy helps. So as the name says, CBT means cognitive behavioral therapy. So here cognitive means your thought process, how your thought process is manifesting into a negative behavior. So when a person comes here, if a patient comes here with a rigid thought, with a negative thought, it is very difficult to change that. So for example, if a person is in addiction, like any kind of alcohol or any kind of drug addiction, so for him, as a therapist, for us to convince him that it is not alcohol which is helping him to get over his bodily condition, it is very difficult for us to make the person understand that he is not doing right. And sometimes here, along with the patient, we also do counseling for the caretakers, because most of the time even the caretaker should also know what the patient is going through and how emotionally they can support them. So once the family is supporting you in a good way, 50% of the problem gets solved there. So when he needs, when he gets that emotional support from the outer side, the patient feel that somebody is helping me to uh, uh, cope up with the cope up with these conditions. So usually it takes more than 5 to 6 sessions, based on how the patient is responding to the therapy. Is he doing well? Because in between the therapy there are certain activities that has to be done, certain assessment that has to be done. So they should they should come back to us after one session. So how many sessions we suggest them to take, they should be willing to take that. So there are patients who may come for four settings, 5 settings, and they may discontinue that. So if that is the thing, the therapy may not work in a better way. Next is JPMR technique. It is basically a muscle relaxation technique. So how we have exercises to relax our joints, in the same way we should also relax our muscles. So what happens when you have stress, when you have anxiety, your muscle gets stiffened. So there will be stiffness in your muscle when you're overstressing. So that muscle has to get relaxed. So what you have to do to relax the muscle? So in this exercises we will teach you how to relax your muscles. This exercise takes 14 to 15 minutes. So usually we ask the patients to do twice or thrice in a day, and again it has to be done throughout. Like, it is not something which you do today and tomorrow you get the result. So it is like joining a gym. So immediately after joining a gym you won't get any result. So it takes time. So here the patients should have interest in doing the exercises. So if they want some immediate result, it is not possible. It takes 1.5 months for you to get that result. So have patients do the exercise, all these exercises regularly, so that it will help you. Then next is group counseling. So here in group counseling, usually more than 4 to 5 patients, we ask them to come, and along with that group we will do the counseling. So what is the intention of doing group counseling? So one thing, when we do general counseling or the individual counseling, what happens? They think everything is happening for them, or all the body pains are happening for them. They are the only person who are suffering. So that is not true. So when they come in a group, they'll start discussing their problem among themselves. Then they'll come to know what are the strategies that can be taken, what are the coping mechanism other person is using, which is helping them. So they'll discuss among themselves. So when they start seeing that, so when they start understanding that you are not the only person who's suffering, other people, there are other people who are undergoing all these issues and they are coping up with that in a good way, they'll get a confidence of living with that health condition. Then the last is acceptance. I think it is one of the most important thing a person should have. And once the person learns how to accept his maybe bodily related issues or the psychological issues, so when the person starts accepting the issue, the mental health condition or the physical health condition, the journey of the person with that disease will be easier. So because once you start putting barrier, it is very difficult to cross that. So accept what you have. It is okay to have rheumatoid arthritis, or along with rheumatoid arthritis, any kind of mental health issues. There are solution for that. There are treatment for that. You have medications. You have physiotherapy exercises. So everything is available. So don't put any kind of barrier. So start living with that, so that it will make your life happier, so that you can lead a happy life. Thank you.
You need any break?
Thank you, Rajeshwari. I'm sure the information provided will definitely help our viewers. Thank you everyone for being with us.